Hello viewers, welcome to my show Bola Kotha, the Untold story from LB24 Midlands. You're actually watching my show from Midlands. I have a guest, not just guest, I have a couples today, and now I'm going to introduce them and you'll find out what they do and what their titles are. So on my right is Hasan. Hello Hasan.
Hi there. Assalamu alaikum.
Welcome. Welcome to LB24.
Thank you for having us, inshallah.
And on Hasan's right, it's Rahana Yasmin. Hello Yasmin, welcome to our show.
Nice to meet you.
How are you today?
Not bad, thank you.
How are you feeling today? Like, enjoying the weather?
Yes, it's very hot at the moment, but yeah, okay, thank you.
Thank you. And Hasan, what do you do?
I'm actually a dentist. Been qualified for about 5 years now, and working in Birmingham myself.
So you are a Birmingham. You're from Birmingham and you work in Birmingham. Very lucky you are. And is your wife from Birmingham as well?
No, I'm originally from Sheffield, and then I studied in Manchester for 3 years, and then I got married and moved here. So,
can you tell me a little bit about yourself as well?
I graduated in dental technology, so I qualified as a dental technician. That was, I think, 2 years ago now, and now I'm training to be a dental nurse. So,
that's great. So both of you are in the same field.
Yeah.
So Hasan, how do you feel like you got a wife? She's in the same field as well.
Alhamdulillah, it does help. It does help. Not that it's an absolute necessity, but it does help when you can talk about your work life with your partner.
Okay, now I'm going to ask you a little bit about your career as a dentist, and I'm going to come back to you, Rahana. Okay,
That's fine, yeah.
Okay, why did you choose this career?
Me personally, I've always been interested in sciences. It's always been my strong point while I was at school. My dada was a doctor back home, so I'm probably got a bit of inspiration from him as well. And in general, I always felt it was always going to be either doctor or dentist.
So it's a family thing.
Yeah, family thing and just personal preference and personal interest really.
Oh, right. So you're good in science when you're at school?
Yeah, that's right.
So you enjoyed doing science?
Enjoyed it, and for me personally, I just think if you're going to do a job for maybe 40 to 50 years of your life, if you don't enjoy it, it's not really going to be a profession, it's going to be a chore. So it's important for me that I went and did something I thought, inshallah, I'd enjoy, and alhamdulillah, I am doing.
So if your parents are happy that what you're doing?
Parents are happy. I think they initially wanted me to be a doctor, like my dada, but alhamdulillah, they supported me with whatever decision I made, and alhamdulillah, they're happy.
So still you got the title of doctor? You're
a
dentist, so
still got the title of doctor.
The dentist is a doctor as well.
Yeah.
Okay, so as a dentist, what are the common cases do you encounter in your clinic?
A lot of the time, it's decay, so that's when patients have got holes in their teeth, especially youngsters. Some parents out there aren't aware of how much damage regular sugar can cause to their kids' teeth. I was one of them actually. That's probably what made me interested in the first place. I used to have a lot of decay while I was young. I ended up having braces, so I had a lot of exposure to dentistry as a child. But yeah, majority of the time, kids coming in with a fair few holes in their teeth, adults coming in with gum disease due to lack of brushing or lack of awareness of why they need to maintain good oral hygiene.
And especially, I should ask you, the pediatric dentist, how much do you know about the pediatric dentist, like, protecting children's getting the gum inflammation and cavity? Okay,
so during our training, we're taught to deal with all sorts of ailments, all sorts of diseases, all sorts of problems, ranging from children all the way up until the elderly. So we are trained to treat children as well as adults as well as the elderly, and we are trained to treat majority of the general cases. So if there's anything that requires specialist attention, we do normally refer on to a specialist, but the majority of kids we are trained to deal with, and we do deal with on a regular basis.
Right, okay. So what normal cases do you face every day? Is it just the brushing, cleaning the teeth in the clinic, or do you actually tell them that how to protect themselves, when they comes to you? Because some people comes with the pain. Some people may be having other problem taking their teeth out, or especially in the elderly
Yeah.
people?
So what we tend to do is that we tend to assess a patients on their individual needs. So it's not like if two patients come in, they're in pain, we just get them out of pain and leave it like that. Our main objective is obviously to treat their problems, treat their pain, get them out of pain, but then enable them to improve their oral hygiene, improve their general oral health, so in the future, inshallah, they won't get these problems again, or they won't get any other types of problems, so that we can bring their risk down, and inshallah they can maintain a good healthy mouth for the rest of their lives.
Okay, and as a dentist, what advice would you give to the youngsters? Like, you know, the problem doesn't actually arises when they're quite young, so to keep them healthy teeth, what tips would you give them?
Okay, so it normally starts from a very young age. So the habits that we tend to pick up from a young age, whether we're brushing very well or brushing very poorly, tend to stay with us throughout the rest of our life. And if we can get the young kids to start brushing really well from an early age, it's a lot easier in the rest of their life. And if we can get them to cut back on sugars, sweets, chocolates, fizzy drinks at an earlier age, it will be a lot more easier the rest of their life for them to maintain that, and then inshallah reduce their risk for the future itself.
Why does children get referred to braces, like where actually a special dentist to actually put the braces on?
Okay.
What's the main reason?
Again, that's become a very popular thing recently, where a lot of children are getting braces. The main reason for that is normally due to there not being enough space in a child's mouth for them to accommodate or have all of their adult teeth line up nicely. So what we tend to recommend for children in particular is definitely come and visit your dentist every 6 months. That way we can always have a regular check, a regular look, and see how things are developing. And if there are any problems, we can pick them up nice and early, identify them nice and early, and then start to make plans for the future, so that if they do need braces, everything is ready for when they reach that age where it's more appropriate.
Right. It has always been said that once a person visited a dentist, and he or she needs to visit again and again. Why is this?
I mean, the main reason for this is that without regular checkups, we can't really assess that patient again and see how they're getting on. That's the main gist of it. I mean, if, for example, you go and get your car MOT'd on a regular basis just to make sure it's running well,
Yes.
just to make sure there's no problems.
So it's same to our body as well.
Exactly the same for the body. If you don't go and get it regularly checked, we can't pick up the problems at an early stage, and a lot of the time if we don't pick it up at an early stage and patients only come in when they've got pain or problems, then it's difficult to treat it at that point. A lot of the time we tend to find patients come in where the problem is gone to such an extent where we end up having to take teeth out, whereas if they'd come for their regular checkups, maybe we would have picked it up nice and early and been able to treat it at an earlier stage.
So how quickly do you respond when somebody's got swollen gum or very inflamed gum? How quickly do you respond? How quickly can you refer them to specialists, not in the dental surgery but somewhere in a hospital?
Okay, I mean, majority of the patients that we see, we can treat in a general setting. So majority of my patients I will treat myself, because majority of the problems are common problems. For the more specialist problems, again, they do need to come in and see a dentist so that we can confirm that it's not just a simple case and that it may need a bit of specialist attention. And at that point, we normally send a letter over to the specialist. Normally within about 4 to 8 weeks, they will get a letter back, depending on the problem and the urgency of the problem. And then from there, the specialist can undertake any further treatments.
Well, I'll go to Rahana now, because I have heard a lot from you now. Then I'm going to ask Rahana some questions about her responsibility as a dental technician. So Rahana, you are a dental technician.
Yeah.
So as a dental technician, what are your responsibilities? What do you do?
So basically, when I graduated, during my degree, what we did was, as a technician, we make a lot of appliances. So we were trained in crown and bridge, prosthetics, so dentures, ortho work as well, so orthodontic appliances. So yeah, those were the main ones that we did. So we were trained in all aspects to make them. But since, because I got married straight after, I haven't had the chance to actually go back in that field and work as a technician.
Okay.
Hence why I'm currently training as a nurse. But I changed my career decision because I prefer patient contact, whereas as a technician we were always in a lab.
Always in a lab.
So I don't really like that side. So, but I still do want to go back into it. I do miss doing the practical side of it. So, Yeah.
What's the meaning of orthodontist? Like, we know dentist and
Yeah. An orthodontist is basically someone who does all your braces and stuff. So it's a dentist, but more qualified and specially trained for braces and things like that, for movement of the teeth, basically. So.
Okay. And what about the denture? Like, not many
Dentures-
people know denture, especially the youngsters, because we know the old people.
Yeah,
like,
the elderly
you
is
probably
some
know
common
elderly
case.
people actually cases have the
Yeah.
denture. But what about the youngsters? Tell me a little bit about the dentures. How it made.
Dentures, you can get partial and full dentures. So full dentures is normally a requirement that elderly people get because all their teeth have gone. So at that point, that's when they go to a dentist, and the dentist prescribes dentures, and the technician makes the dentures for the patient. Partials is actually quite common nowadays with a wide range of people, because many people, like some people lose their teeth quite young from trauma or accidents or anything like that. So those kind of people who have few teeth left but have some
So they
missing.
have partially.
Yeah, they have
denture.
partial dentures put in. So we've got partial and full dentures.
So as you say, you don't actually enjoy working in a lab. So what are your future plans? Are you going to change it to somewhere that you'll be directly contact with the patients?
Well, at the moment, like I said, I'm training as a nurse, which I'm as a dental nurse, which I'm really enjoying, and I'm hopefully qualifying in January next year. And once that's done with, I'm hoping, like I said, to go back in as a dental technician, train up as a technician again, and possibly go into clinical technician, because as a clinical technician you can actually be by the patient side and do the impressions instead of the dentist, because usually the dentist does the impressions and they send it to the lab and then you do it in the lab. Whereas the clinical technician, they can take the impressions themselves. They can be with the patient.
So the dentist actually refers the patient to the dental clinic where you could take the impressions.
Yeah, in a sense.
In a sense.
Yeah.
Okay.
Yeah.
That's great. So both of you are husband and wife in the same field.
Yeah.
So what do you feel like, being in the same field? Like, do you clash, like both of you? Anything that?
I wouldn't say we clash. At the moment, because my wife is studying, I can support her through that. Obviously, I'm a qualified dentist, so I should know most of the things that she's studying. So I can support her through her studies. And like I mentioned before, sometimes when you're having a stressful day, it's good to come back and talk to your wife about work, and she understands what's happening and what you've been going through throughout the day. So it's always good. And similarly, she can come back and talk to me about some of the things that's gone good in her day or bad in her day. So it's always good that we can understand each other and we understand what we're both going through, really.
So do you learn from her and she learns from you as well?
Oh yeah, I'm always learning. I'm always learning.
Always learning
Pretty much,
something
yeah.
different. Yes.
And it's interesting as well, the cases as well that we sometimes get. It's quite nice to chat about it, because it's like, oh, did you know this and did you know that?
Oh yeah, that's nice. Yeah.
So yeah.
So as a wife, you married now, you're studying and you're actually working as well. So your work is a part of training. So how much did you sacrifice to study after marriage for your career?
To be honest, I didn't actually want to study after I got married, because obviously I got a degree anyway. I didn't think I'd need to study again, but after a lot of thinking and a lot of contemplating, I just wasn't feeling going back into as a technician. And I spoke to my husband about it, obviously, and my in-laws about it as well, see if they were okay with me studying again. And alhamdulillah, it worked out, and I'm really glad I am studying again and working again as well. So, yeah.
Tell me a little bit about your marriage. Was it a love marriage or arranged marriage?
No, this is quite interesting, because when it was an arranged marriage, but when it actually all worked out, everybody presumed it was a love marriage, because, like I said, as soon as I graduated, literally I got married. Like his proposal came. And it worked out, alhamdulillah, and so people just assumed, because it was so straight after my uni, they just presumed it was a love
you
marriage.
two are in the same field.
Yeah, so they just presumed it was a love, but no, it was an arranged marriage. So yeah, but yeah.
So both of you are happy.
Yeah,
Alhamdulillah.
Yeah.
Okay, that's nice. Okay, and now I'm going to ask Hasan a little bit more about the dentistry.
Sure.
Okay, so Hasan, to become a dentist, how long it took you to become qualified dentist?
Okay, the official answer to that is 5 years, because you have to do 5 years at university. Although I would say preparation starts from even before that, because you have to make sure your A levels are good, you have to make sure your GCSEs are good. So theoretically, you're probably looking at probably about 10 years, and you have to start from a very young age. Reason I say that is because when I applied for dentistry, it was very competitive, but now it's even more competitive than before. So you really need to get your head down, you know, work hard throughout your school life, GCSEs, A levels, because at the moment the criteria for getting into university for medicine or dentistry is very high. So they're normally looking for 3 A's or somewhere towards that. So I would definitely say the hard work does start early, but it will definitely pay off in the end. After that, after you do your 5 years at university and you come out with a BDS, which is your Bachelor in Dental Surgery, you then have to normally do 1 year in NHS training before you can go on to work full time in the NHS itself. And that's just 1 year training, and after that you get your final certificate. You're qualified dentist after university, but it's an NHS criteria that you work for an extra year.
Right, okay. So it's a long journey.
Yeah, it's a fairly long journey. There's ups and downs along the way, like in any profession, any career. But as long as you get your head down, you know what you want to do, work hard towards it. Anything you want in life will always take hard work. But inshallah, eventually you'll get there.
That's nice. Okay. So what advice would you give it to someone who wants to get into dentistry? Do you enjoy your work?
Alhamdulillah, I enjoy my work. The main reason I chose dentistry over medicine was because personally I didn't want to sit behind a desk and just type up on a computer and talk to patients. So for me, I was a bit naive. That's if I thought I went into medicine, I thought that's all I'd be doing as a GP. But there are different avenues to in medicine. It's not just sitting behind a desk like a GP does. There's other avenues like surgery and working in a hospital. I was a bit naive at that time, and that's where I thought medicine would take me. So I decided to do dentistry instead. It's a lot more hands-on. You're always doing treatment to patients. Probably 60 to 80% of your time is doing treatment, whereas the other 20 to 40% is doing paperwork. And that was my main drive. You know, you've got to understand what your best attributes and characteristics are, what you're going to enjoy in the future. I mean, looking back, I still sometimes think maybe I should have done medicine, but alhamdulillah, I enjoy what I do now. I like waking up in the morning, going to work, seeing my patients, treating them, putting a smile on their faces, you know. So I get job satisfaction, and I think that's the most important thing. You have to do something that you think you're going to enjoy, for you to be able to enjoy your life. Otherwise, if you go to work not enjoying it, your life becomes very boring, depressing, you know, etc. Money will come and go. Alhamdulillah, the money is good, but I wouldn't recommend anyone to go into dentistry just for the money. It is a stressful job. There's a lot of stress involved. So if you're going into it just for the money, you may not enjoy it as much as you think you will.
That's good. That's great. What about the patients? What do you do to the patient who are very scared when they come to your clinic?
Okay, we do get a very broad range of patients. Some are very happy to be there. They're not scared at all. Those are the very easy patients to deal with. But at the same time, you do get very scared patients. I've had some patients who are scared just to walk in through the door of my clinic, even sit down in the chair before they even start to talk to me. I remember I had one patient while I was working up in Manchester who I had to talk to in the waiting room because they refused to come in and see me in the clinic itself. So you do get a very broad range of patients, and the most important factor of a dentist for me personally is you can be the most skilled dentist in terms of your treatment can be 100% every single time, but if you can't manage your patient, if you can't talk to your patient, if you can't calm your patient down, if you can't make sure that your patient is comfortable and at ease, then whatever treatment you try and do is always going to be difficult. So
is it just in adult or in children's as well? Right?
Everyone. So we get children who are crying, we get adults who are crying. You'll be surprised at the number of big bodybuilders with tattoos that you've got sitting in the chair crying because of an injection. But at the end of the day, that's another thing that you need to treat. So you need to understand that there's a reason why they're scared. Normally what I do is take it easy when they first come in. I don't do any treatment. I just sit down, talk with them, have a quick look inside their mouth, tell them roughly what their problems are, what treatment they might need, what that's going to involve. So different patients react differently. And again, you're not just doing treatment to a person, what I like to say to, there's a lot of work experience that we take on in our practice, and we always talk with them what we do, is that you've got to remember there's a person on the end of that tooth that you're treating. So it's not just a tooth that you're treating that person. So different patients need different treatments as well as different management.
Right, okay. So what advice would you give it to not just children's, like, when children visit dentists, they always get told, don't eat too many sweets, or what about the adults who are actually coming with the teeth problem? What advice would you give it to them?
So the way I tend to work is that whenever I see a patient, I always let them know of their risk. So if they're at high risk of decay, high risk of gum disease, I let them know. If they're low risk, then I'll let them know. And then after that, I tell them how they can go from high risk to low risk. And if they're at low risk, how to maintain that. So the general advice we tend to give most of our patients is, with regards to decay, where you start to get holes in your teeth, is the most important thing is sugars. So cut back on the daily sugar intake. So sweets, chocolates, fizzy drinks, sugar in your tea, sugar in your coffee. Us Asians, we like to drink a lot of tea and coffee, but it's not just the amount of sugar that we're having, it's also how often we're having it. So for example, a heavy tea drinker or a heavy coffee drinker, if they're having 4 or 5 cups of coffee a day and they're having 2 spoons of sugar in the day, then that adds up to 10 spoons of sugar in a day, and that's a lot of sugar. And if they're having it regularly throughout the day, then we're having regular sugar into the mouth, and that's something that we call sugar attacks. So every time you have some sugar, it does attack your teeth. If you have it less frequently, then your mouth can deal with it, because your mouth has got certain defense mechanisms to deal with it. But if you're having a lot and you're having it frequently, then that's when the mouth can't deal with it, and that's when we start to get holes.
How effective is the chewing pan, especially in our community? Like, lots of adults are chewing pan, and with different kind of flavors. So have you actually advised any patients not to chew pan? So
Okay, well, I work in Bawdsey Green, which is has got a fairly large Bengali community, and as we know, Bengalis, they do like to chew their pan. What a lot of them don't understand is it's not just the staining of the teeth, which is what a lot of them come in with. They come in complaining that they've got black or brown marks on their teeth. It doesn't look nice. They want that cleaned up. But more importantly than that is, number one, gum disease. It can have a very drastic effect on the gums. And eventually, if gum disease is allowed to propagate and continue, then eventually the teeth become loose, eventually they will fall out, and that's when we start to have problems of having gaps in the teeth. But even more importantly than that, those patients who tend to have pan with sun or shada, okay, there is quite a increased risk of mouth cancer as well. So we normally say anywhere between 15 to 20% increased risk of mouth cancer, and again, that's a very serious complication. So again, we tend to recommend avoiding those kinds of things. The general pan and gua is okay, but it's when we start to add the other bits and pieces onto that, which tends to increase the risk. But again, we tend to recommend cutting back as much as possible.
thank you, Hasan. I'm just going to ask you last question. Do you
Sure.
still believe in, like, eating an apple can help maintaining your teeth?
Well, apple
A day.
apple a day normally keeps a doctor and dentist away. Apple again is a form of natural sugar, okay, which it definitely won't hurt the teeth. But no, definitely keeping a healthy diet, visiting your dentist regularly as well will definitely avoid any problems, inshallah.
So what about with the sensitive teeth?
Sensitive teeth is another issue. Again, we do get a lot of patients with sensitive teeth.
Yeah.
Our diet doesn't help. Sometimes we tend to have a very acidic diet which affects the teeth themselves. So again, tea, coffee can sometimes contribute to that, but more importantly, fizzy drinks and things like that. Normally we can prescribe some toothpaste sometimes, but again, it's a matter of maintaining the brushing, maintaining the oral hygiene, and maintaining a good diet.
Thank you very much.
No, you're
Thank
welcome.
you, Hasan, and thank you, Rahana, for
Thank
being
you.
with us today.
No
And it was
problem.
wonderful to talk to you, and good luck in your married
Oh,
life.
thank you.
Thank you very much.
Thank you.
Thank you.
Thank you, viewers. Thank you for being with us today. I hope you enjoyed my show, Bola Kotha, the Untold Story, with Hasan and Rahana. And that's all for today, and I'll see you next time in my next show, Bola Kotha, the Untold Story.